Hi, my name is Shireen Lewin, and today I'll be talking about exploring the effectiveness of mindful based interventions for reducing stress and anxiety amongst family nurse practitioners. So, a lot of the times, family nurse practitioners face high workloads, emotional strain, and pressure to meet healthcare demands. These factors contribute to elevated stress and anxiety levels, affecting both their personal health and professional performance. This is a significant problem because chronic stress among healthcare providers can lead to burnout, decreased productivity, and poor outcomes. Mindful based interventions, which focus on present moment awareness and non judgmental reflection, have gained popularity for promoting mental well being. However, limited qualitative evidence exists on their impact specifically for family nurse practitioners. By exploring this gap, we can identify strategies to support family nurse practitioners more effectively and improve workplace sustainability. The study by Knudsen et al. Is particularly valuable as it provides insight into how family nurse practitioners experience mind-based interventions and perceive their usefulness. Their presentation will explore the findings, methods, and implications in detail. So the PCOT is a format that helps formulate research questions in evidence-based practice to gather relevant patient-specific evidence. So I came up with the question, and the question is, in family nurse practitioners experiencing stress and anxiety in outpatient settings, how effective are mindful-based interventions compared to no interventions in reducing stress and anxiety levels over 8 to 12 weeks? Here's a little background. Family nurse practitioners are advanced practice nurses that provide care to patients of all ages. Their training and board certification enables them to diagnose, practice, and treat diseases in varying care settings. More than 70% of nurse practitioners, including family nurse practitioners, deliver primary care. The nurse practitioner workforce has increased fourfold from 91,000 in 2010 to about 385,000 in 2023. Nurse practitioners, including family nurse practitioners, experience exhaustion all the time. Only fewer than a half of them receive appropriate support and recognition. They also experience burnout and anxiety associated with their negative work environments. Research shows that patients are likely to seek emergency care when attended to by nurse practitioners experiencing psychological challenges. This means that their poor mental health outcomes result in poor quality of health care delivered to patients. Can you believe that? Family nurse practitioners' burnout remains a significant challenge in outpatient care settings. The problem is exacerbated by factors such as lack of organizational help, inadequate staffing, poor interpersonal relations, and devaluation. Evidence demonstrates that nurse practitioners who experience burnout and stress feel marginalized and fear raising their concerns. Besides stress and anxiety caused by the nature of their work, environments result in poor patient outcomes. Subsequently, research into the issue provides effective strategies to address it and improve the health outcomes of FNPs. The research question centers on understanding how family nurse practitioners experience and interpret the effects of mindful-based interventions on their mental well-being. Given that this question focuses on individuals' perspectives, emotions, and interpretations, a qualitative design is appropriate. Unlike quantitative studies that seek measurable outcomes or statistical relationships, qualitative research provides deeper insight into how and why interventions are perceived as effective. The selected study used semi-structured interviews to allow participants the space to share their personal stories. This approach is particularly effective for sensitive topics like stress and mental health. It also acknowledges the complexity of the nursing role and the subjective nature of stress and anxiety. In summary, a qualitative study supports the goal of capturing nuanced experience and understanding the impact of MBIs beyond what numbers alone can show. Dorothea Orum's theory of self-care deficit provides a strong foundation for this research problem. It suggests that when individuals are unable to care for themselves adequately, nursing interventions are needed to help bridge this gap. In the context of FNPs under stress, their capacity of self-care may be diminished, impacting their emotional health and clinical decision making. MBIs serve as a form of supportive care that empowers practitioners to re-engage in their well-being. Applying Orum's theorem helps illustrate how mindfulness can restore autonomy, emotional resilience, and overall professional functioning in FNP. The literature review uncovered a consistent theme of stress and burnout among nursing professionals, including nurse practitioners. Mindful-based interventions have been shown to lower stress, improve focus, and enhance emotional regulation. However, few studies target FNP specifically or explore their in-depth subjective experiences with such interventions. Qualitative studies offer rich data by capturing narratives that illuminate emotional and cognitive changes. The selected study effectively addresses this gap, bringing unique insights into how MBIs can support the emotional health of advanced nursing professionals. The main purpose of the study is to gain a nuanced understanding of how FNPs perceive and experience MBIs in managing stress. The chosen qualitative description design is well suited for exploratory research where limited existing data is available. This design offers flexibility in gathering narrative data through open-ended questions and allow participants to share their insights without constraints. It supports the researcher in developing themes from lived experiences and provides valuable context to guide future intervention design and policy implementation. Ethical conduct was a key aspect of the study. Informed consent ensured participants were fully aware of the study's intent, risk, and benefits. Confidentiality was upheld by anonymizing data and securing storage. Purposive sampling was selected to target FNPs who had undergone mindful-based stress reduction programs, ensuring the sample was relevant to the research question. Email and professional networks were effective for recruitment, allowing the researcher to assess a specialized group of practitioners likely to have a relevant experience to share. The study used semi-structured interviews, which allowed participants to freely discuss their experiences, while maintaining focus on mindfulness and stress. This approach generated rich, detailed data. Interviews were transcribed verbatim and subjected to thematic analysis, a common and rigorous method in qualitative research. Thematic analysis involved identifying, coding, and categorizing patterns within the data. Key themes such as emotional clarity, enhanced coping, and increased resilience emerge, aligning with the study's goals and contributing to nursing knowledge on stress management practices. To evaluate qualitative rigor, 4 key criteria were used: credibility, transferability, dependability, and confirmability. The study's credibility was enhanced by member checking. Participants verified the accuracy of their transcribed responses, interpretations. Transferability was strengthened by richly describing the participant group and research setting, enabling readers to determine relevance to other contexts. Dependability was addressed by providing detailed accounts of procedures, ensuring consistency and replicability. Confirmability was ensured by maintaining audit trails and reflective journals, reducing researcher bias and reinforcing neutrality. The study found that family nurse practitioners reported a range of positive effects from participating in mindfulness-based interventions. These included decreased stress levels, improved emotional regulation, enhanced clarity in decision-making, and better work-life balance. Many participants emphasized the value of group-based support and structured mindfulness exercises. Limitations included the small and self-selected sample size, which may not represent all FNPs. The study was conducted at a single institution, which may affect generalizability, but the findings still offer valuable guidance for future program developmental. This qualitative study is deemed trustworthy because of its methodological transparency, the relevance of its findings, and alignment with existing literature. The detailed participant narratives and consistent themes support its authenticity and usefulness. For nursing practice, the findings have practical implications. MBIs can be used to support FNPs struggling with stress and anxiety. Nurse leaders and healthcare administrators should consider implementing structured mindfulness programs as part of broader staff wellness strategies. Future studies can build on this work by incorporating larger, more diverse samples and examining sustained effects of MBIs over time.